Welcome to Blood Sugar Squad, your go-to channel for simple, actionable tips to manage diabetes and live your best life. Farxiga is one of the most commonly prescribed medications for type 2 diabetes. It lowers blood sugar, helps with weight loss, and has been shown to protect the heart and kidneys. But like any medication, it comes with side effects and important safety information. If you are starting Farxiga, or your doctor has mentioned it as an option, you probably have questions. In this video, we are going to break down everything you need to know about Farxiga, how it works in your body, the most common side effects, the rare but serious risks, and when to call your doctor. Segment 1. How Farxiga works. Farxiga belongs to a class of drugs called SGLT2 inhibitors, the same class as Jardiance. Normally, your kidneys reabsorb glucose back into your bloodstream. That is your body trying to hold on to energy. But for people with type 2 diabetes, blood sugar levels are already too high. Reabsorbing that extra glucose only makes things worse. Farxiga blocks a protein in your kidneys called SGLT2. This prevents the kidneys from reabsorbing glucose. Instead, the excess glucose is flushed out through your urine. This lowers blood sugar through a completely different mechanism than many older diabetes medications. On its own, Farxiga has a relatively low risk of causing hypoglycemia, although the risk can increase when combined with insulin or certain other diabetes drugs. Increased urination is one of the most common side effects. Some people also notice modest weight loss because they are literally eliminating excess glucose and therefore calories through their urine. The fluid loss can also slightly lower blood pressure in some people. Beyond blood sugar control, large clinical trials found that Farxiga can reduce the risk of hospitalization for heart failure and help slow the progression of chronic kidney disease. In fact, Farxiga is now approved not only for type 2 diabetes, but also for certain patients with heart failure or chronic kidney disease, even if they do not have diabetes. That is one reason these medications have become such a major part of modern diabetes treatment. Segment 2. Common side effects. Increased urination is number 1. This is not a sign that something is wrong. It is the medication working as intended. For some people, this is most noticeable during the first few weeks. For others, it continues as long as they take the medication. If nighttime urination is disrupting your sleep, taking your dose in the morning rather than later in the day may help. The extra urination can lead to dehydration, especially if you are not drinking enough water. Signs of dehydration can include dry mouth, dizziness, headaches, feeling weak, or feeling lightheaded when you stand up. Staying hydrated throughout the day usually helps reduce these symptoms. Some people also experience genital yeast infections. Because there is more sugar in the urine, yeast can grow more easily in warm, moist areas. This is more common in women, but it can also happen in men, particularly men who are uncircumcised. Symptoms can include itching, redness, irritation, or unusual discharge. The good news is that these infections are usually mild and treatable with over-the-counter or prescription antifungal medications. Urinary tract infections, or UTIs, can also occur. Symptoms may include burning with urination, pelvic discomfort, cloudy urine, blood in the urine, or feeling like you constantly need to go. Most UTIs are mild, but if symptoms become severe or are accompanied by fever, back pain, or vomiting, contact your doctor promptly. Finally, Farxiga by itself has a relatively low risk of causing hypoglycemia, or low blood sugar. But the risk can increase if it is combined with insulin or medications called sulfonylureas. Symptoms of low blood sugar can include shakiness, sweating, confusion, rapid heartbeat, or feeling suddenly weak or hungry. Segment 3. Serious warnings and rare side effects. One of the most serious risks is a very rare infection called Fournier's gangrene. This is a severe bacterial infection that affects the genital and perineal area and can spread rapidly beneath the skin. Symptoms can include severe pain, swelling, redness, tenderness, fever, or a foul smell in the area. If this happens, seek medical attention immediately. Another rare but serious risk is diabetic ketoacidosis, or DKA. With SGLT2 inhibitors like Farxiga, DKA can sometimes happen even when blood sugar is not extremely high. Symptoms can include nausea, vomiting, stomach pain, unusual fatigue, confusion, or trouble breathing. If you experience these, seek medical attention right away. Farxiga can also affect kidney function in some people, especially older adults, people with existing kidney disease, or those taking medications that affect the kidneys. That is why doctors usually check kidney function before starting Farxiga and monitor it periodically afterward. These side effects are very rare, but they are important to recognize early. We also did a separate deep dive video covering these serious SGLT2 inhibitor side effects in more detail, and I will link it at the end of this video. Segment 4. Who should not take Farxiga? Farxiga is not for everyone. There are specific situations where it may not be appropriate or may require extra caution. If you have severe kidney disease or are on dialysis, Farxiga is generally not recommended. The medication works through the kidneys, and reduced kidney function can make it less effective and increase certain risks. If you have a history of recurrent urinary tract infections or genital yeast infections, you may be more prone to these side effects while taking Farxiga. Talk to your doctor about whether the benefits outweigh the risks in your situation. Farxiga is also not recommended during the second and third trimesters of pregnancy because it may affect kidney development in the fetus. If you are pregnant, planning to become pregnant, or breastfeeding, discuss alternative options with your doctor. And if you are planning to have surgery or will be fasting for a prolonged period, your doctor may ask you to temporarily stop taking Farxiga. This is because the risk of diabetic ketoacidosis can increase during periods of physical stress, illness, or reduced food intake. As with any medication, do not stop taking Farxiga without talking to your doctor first. Suddenly stopping can cause your blood sugar to rise. Segment 5. The bottom line. Farxiga is a highly effective medication for type 2 diabetes. It lowers blood sugar, promotes weight loss, and protects the heart and kidneys. For many people, the benefits far outweigh the risks. But like any medication, it comes with side effects you need to know about. Increased urination is expected, and it means the drug is working. Dehydration can be managed by drinking more water. Yeast infections and UTIs are possible, but usually treatable. The rare but serious risks, Fournier's gangrene and DKA, are real, but they are also extremely rare. Knowing the warning signs is your best protection. If you are starting Farxiga, here is your checklist. Stay hydrated. Watch for signs of infection. Take your dose in the morning if nighttime urination bothers you. And if you are also on insulin or a sulfonylurea, monitor your blood sugar closely for lows. And most importantly, do not stop taking Farxiga without talking to your doctor. The benefits for blood sugar, heart, and kidney health are well established. Managing diabetes is not just about the medications you take. It is also about the food choices you make every day. That is why we created Mindful Eating for Diabetes. It is a free, practical toolkit to help you build a healthier relationship with food with no extreme diets or complicated rules. You will find simple strategies to stabilize blood sugar, manage cravings, and make eating feel easy again. Just use the QR code on screen or the link in the description below. Segment 6. Final thoughts. Farxiga is not the right medication for everyone, but for many people with type 2 diabetes, it can be a game changer. Lower blood sugar, weight loss, heart protection, kidney protection. That is a lot from one pill. The key is knowing what to expect. Increased urination is normal. Dehydration is manageable. Yeast infections and UTIs are treatable. And the rare but serious risks are something you need to be aware of, but not scared of. If you are taking Farxiga or considering it, talk to your doctor about your specific risks. And if something does not feel right, trust your gut and seek medical attention. Have you taken Farxiga? Comment below and please share this video with someone who is considering Farxiga. Until next time, stay strong, stay sweet, but not too sweet, and keep thriving with the Blood Sugar Squad.